Hi everyone, and welcome to the final lesson in the Medicine Through Time course. We're going to focus today on fighting lung cancer in the 20th and 21st century. And our question is, how has the fight against lung cancer developed in the 21st century? Now, obviously, remembering that word develop generally means to get better, progressed. What technology have we talked about in the last couple of lessons that might give us a bit of an idea about where we're going with this? So obviously it'd be things like chemotherapy, the diagnostics that we've now got, the MRI scanners. So this is what they would call, Edexcel call the case study, which is designed to bring together everything we've learned in the topic to be seen in one specific case study. And they've chosen lung cancer of all the things they could have picked, but that is where we are, and you might be examined on it, so we need to make sure we have the information that we need. All right, so how has this fight against this horrible disease developed in the 21st century? And it will touch on lots of the things that we've learnt about in the previous two lessons, especially government intervention in the NHS lesson and the technology and the diagnostics. So, lung cancer is the second most common cancer in the UK. Over 40,000 people are diagnosed with it every single year. About 70% of those are caused by smoke and tobacco. 2 out of 3 people die within 12 months of being diagnosed with the disease. It's absolutely horrendous. It's horrible. Only 1 in 10 people with lung cancer live for more than 5 years. These statistics have meant that there's been a real focus on trying to reduce the deaths from lung cancer in recent decades, and we know that from some of the actions the government have taken already in the NHS lesson. So those developments that we've talked about, the campaigns to try and make people not smoke, and all those kind of things, and we'll touch on them again in this lesson as we've mentioned. So as we say, lung cancer is the second most common cause. It affects people mainly over 40, generally because they've probably been smoking for a little while. And 85% of people with lung cancer smoke or have smoked. It's only more recently where there's been a bit of doubt as to connection where this number is starting to fall. But generally speaking, people who have lung cancer have, in the vast majority of cases, smoked or still do smoke. All right, and this is a little graph to get us into the start of this topic to see the rise in lung cancer cases from the 1900s right up to the 1930s. We can see this quite dramatic rise up into percentage of cancer cases. Really what that's attributed to is the fact that smoking was sort of glamorized a little bit in the 1920s. During the war in the trenches, the men smoked as the least of their worries probably at the time, but nobody knew the long-term damage of this. Like we're sort of saying with vaping today, we could look at a similar graph perhaps in 2050 after 3 or 4 decades of people vaping to see what kind of might happen there later on. But generally speaking, we can see that the rates of lung cancer have gone up since the start of the century, and that's due to, well, as I say, people smoking in the trenches maybe, the glamorization, the Hollywood actors, they all smoked. It seemed to be the thing to do, and nobody really thought that it could cause lung cancer until we get to the 40s and the 50s especially. This graph keeps going up. There is this massive sort of problem, loads of people getting lung cancer, and then somebody in the 50s decided to maybe try and connect the two things. So how has science technology helped in diagnosing this thing? We should be quite confident by now on the ways that we can diagnose these things. We've seen the MRI scanners, we've seen the blood tests, we've seen the CAT scans, we've seen all these things in the recent lessons, but generally speaking, it's still really hard to treat, even when it's found. When it's found, generally it's because it's too late. So lots of people often mistake their symptoms for something else. A lot of old people just say, oh, I'm getting old now and things like that. Previously in the 20th century, lung cancer was diagnosed using an X-ray. So they were looking for a tumour. Now, obviously, with the MRI scanners and the CT scanners, they give us much more detailed looks than actual sort of just a lump or something there. They show us the tissues that aren't right, tissues that are looking to be inflamed, things like that an X-ray can't show. So this really isn't ideal because obviously they're looking at other things in the body that could be mistaken for a tumour, like abscesses. So X-rays weren't really the best thing for it until we get our technology in the MRI scanners and the CT scanners. That's kind of what changes everything. So you can see in these two images here, X-rays, about lung cancer, and both of these people have lung cancer. You can clearly see that it shows something, but it could be anything. It could be an abscess. This is why they have the MRI scanners and the CT scanners that take a 3D picture and also much deeper than just sort of looking at tissue and looking for a lump. Okay, so these X-rays definitely might be a starting point in the diagnosis journey. And then they would lead on to further tests if the doctors who've taken the x-rays suspect that this could be something more sinister than an abscess or just anything other than lung cancer. But it could be a starting point that takes us then onto the CT scans. All right. So this little diagram, once each of the boxes are revealed, just either draw something similar in your notes, so stage 1 down to 2, and basically the flow chart of what you're about to see. Again, the links, if you're watching the video, you won't obviously be able to see those on this video, but on the PDF, the PowerPoint that's attached to the website in the medicine section, right next to where you click the link to watch this video, then you'll be able to click on the links of those other YouTube videos. They just give us a little bit of a diagram, a 3D model of how the things we're going to unveil now work, the diagnostics. All right, so we'll unveil them one box at a time. Just make your notes as we go. Okay, so the first box that we're talking about here is the patient's likely to be given a more detailed type of x-ray. So they've had the x-ray, it's shown something, and the doctors are a bit concerned, so they'll take you for a CT scan. Patients are injected with a dye before the scan takes place. This helps the lung show up much more clearly in the scan. So just get yourself maybe noting that. Just write it as it is, or summarize it, but make sure it makes sense. This is just part 1 of the diagnostic process. Remember back before the NHS, people would not be able to have these kind of diagnostics because they couldn't afford it. Now the NHS is there to provide it. So that's a really important link back to the importance of the NHS, but also the importance of technology as well. So following on from that, if the CT scan shows that cancer might be present in the lungs, then the doctors have got a choice. 2 things they'll do. 1, they'll send off, if the cancer does not look very advanced, so early on, the patient might be given a PET scan. It's like a CT scan, except a small amount of radioactive material is injected into the body instead of dye. This helps the doctors identify the cancerous cells. So that is a bit more invasive, a bit more dangerous. Obviously, a little bit of radioactive stuff is going in the body, but they have a reason to do that if they think that it's early enough. The patient then also might be given a bronchoscopy. This is where a camera on the end of a long, thin tube, and we talked about that, didn't we, in the technology, in the endoscopes. This is passed out into the lungs where it collects a little sample of the cells for testing. So a biopsy of tissues and flesh, remember, they'll pull that out of the lungs and they'll send that off. So they'll possibly do both of these things or one of them, but that will give them a really good, sure sense that it is lung cancer and how advanced it is. After carrying out these tests, the doctor will then be able to determine what type of cancer the patient has and how far advanced it is. As I just said, this makes it possible to draw up a treatment plan to then attack the cancer. So this flow chart, if you like, is really straightforward, but gives you a bit of an idea about what it is that we're doing. Now, what we are saying in an exam question, in a paragraph about the improvements in diagnostic, it's about the technology, isn't it, that we can do, and the early diagnosis leads to hopefully better treatment and better outcomes. Not necessarily right in a paragraph, the flow chart of this, but it just helps you to get your head around what you're trying to say and how there's a process now using technology that helps people be diagnosed fully and hopefully earlier. Okay, hopefully that makes sense, and we'll move on because this is not really a topic worth dwelling on too much because it's obviously horrendous. But with that said, if you want to go and watch those little videos, they're really, really quick, just sort of 3D designs of how the testing works. As I say, you can watch it on the PDF that is on the medicine section of our website, stchistory.com, in the GCSE bit. All right, so this diagram, again, shows very clearly the stages of lung cancer. We've got the healthy lungs at the first one with no cancer at all. Then we've got early stages. You can start to see it sort of evolving and developing. It's in both lungs. And then late stage cancer, you can see that it's really much taken over quite the majority of the lungs. And not a particularly nice thing to dwell on. However, that is the imagery of how this thing goes. So the sooner we can get it diagnosed, clearly, the more chance that we've got of dealing with it. So quick sort of questions to make sure you kind of get your head around what's going on here. In your book or on your notes, pause the video and just answer these questions. To identify and describe the most common cause of lung cancer, explain why lung cancer is so difficult to treat, and how is science and technology helping in the diagnosis of lung cancer. So you'll be able to go back through the video if you've missed a little bit and watch it again. Come back, unpause the video, and we'll go through the answers ourselves. All right, welcome back. So identifying and describing the most common cause is clearly smoking. Or tobacco. explain why lung cancer is difficult to treat, generally speaking, because it could be masked for all sorts of things. Might just be people getting a bit older, they don't necessarily go to the doctors about it. Wheeziness could be anything, couldn't it? So by the time you've actually realised, it's possibly too late. And also where it is in the body, it's really hard to sort of see clearly without some sort of scanning or invasive surgery. How is science technology helping? Well, obviously we've got the x-rays that lead to the MRI scanners, lead to the CT scanners, and injecting the dyes and the radioactive stuff into the lungs so the pictures show up clearly. That then leads us on to our treatment plan. All right, so hopefully you're okay answering those three questions. Just gets our head around a little bit what the point of this topic is, and we can maybe, in our answers to that, would be included in our paragraph about why diagnosis is so good, and especially early diagnosis, and why that's progress really in what's been and done before. All right, so how has science and technology now helped in treating lung cancer? This image here, you can clearly show the importance of that CT scan. This is obviously a cross-section of a body that goes into the CT scanner, and there's no doubt at all you can see there's a lot of cancer on the patient's right lung, or your left as you're watching this. So now we have two options. We now see that there we have surgery to remove the tumour, if possible. Now again, the problem with that is on the lungs, it's really difficult to get in. There's lots of things in the way, like rib cages and your sort of tummy and your intestines and all of that stuff. It's just not really that easy. And then we can then maybe do chemotherapy and or radiotherapy to try and get rid of any cancerous cells once we've removed the tumour. So first thing would always be to try and remove the tumour, and then anything that's left, they might use chemo or radiotherapy to try and kill the remaining cancer cells so they don't regrow and redevelop. All right, so if it is diagnosed early enough, all of that is important on how early the diagnosis has been. Doctors can then perform this operation, as we've just mentioned. And it can range in from taking a small part of the lung to taking the whole lung. Lung cancer patients are now likely to be treated using a mixture of surgery, radiotherapy, and chemotherapy. And as we've said, the examples there, firstly surgery, then chemo. All right, so that is the sort of gist of kind of what would happen. We'll talk a little bit about transplants in a minute. That's obviously a more modern thing, but that's now a possibility as well, a whole transplant, if the lung is too damaged or if they've taken too much away, and if it would affect the life of the patient afterwards, because clearly you need your lungs to breathe. And if you haven't got a strong lung, or you've only got one, then obviously simple activities like just walking, carrying the shopping in from the car, things like that become almost impossible. So the next thing after that would be transplants, and that is a very much a more modern idea. Okay, so again, in this diagram, just write your notes as they come, as we reveal each circle. This is a treatment diagram for areas of how they treat. So the first thing, as we've mentioned now, today, in the 21st century, it might be possible to replace the lungs that have cancer completely with a pair of healthy lungs from someone who's just passed away in the right conditions by being a body organ donor. All right, that's what you might hope for. You might be on a waiting list for a lung transplant, and hopefully that would come through for you. Radiotherapy, this is again new technology. They send waves into the body to hopefully shrink the tumours. A patient receives the radiation either through beams from outside or through wires inserted into the lungs next to the tumour. So really brilliant, impressive stuff, but scary stuff as well in the sort of what they're doing. Whilst it is mind-blowing, especially to those physicians and doctors of the past, it's kind of nuts, isn't it? But they can do this. They might also do a little bit of genetic research. That goes on all the time now. Clearly, we've looked at the DNA and the genetics. We've seen it in that lesson. But it also is helping us now with lung cancer and other cancers. So it's not yet possible to use genetics to treat lung cancer. However, scientists are studying the genes of cancer sufferers to see if some treatments work better on certain people with certain genes. And then obviously that will affect later on treatment plans. If they know that a person who's got X gene or whatever, this treatment works really well, and those persons who've got a Y gene, for example, we know this treatment doesn't work. So that's the future of dealing with cancer, and why it's really important that they do these tests alongside the patients and patients who've died as well. And hopefully they can get a whole lot of data really that will in the future, in the next couple of decades, make sure treatments are really quick, really specific as well to your body type and your genetics, which will hopefully lead to much greater outcomes for everyone who has cancer, and all cancers, not just lung cancer. All right, and then the last thing they might do to treat is a bit of chemotherapy. That's probably the one we're most aware of, the most famous one probably. A patient is injected with loads of different drugs, chemicals. That's why it says chemotherapy, chemical therapy. And the idea of that is it's going to shrink the tumour, reduce the symptoms of the cancer if the tumour cannot be operated on. So that might be your sort of last hope, that you can't take it out, you can't take the lung out. So we're going to just try chemotherapy now to try and kill or shrink the tumour. All things there are up for grabs, really, for the doctors and the surgeons to try and decide. And everyone's cancer treatment is pretty unique to them, but it's going to be one of or some of or all of these things here. So that is your notes for how treatment has developed in the 21st century. We've now done treatment and diagnosis. Hopefully you can see that these things are phenomenal in terms of progress. So now we want to just remind ourselves a little bit, this case study, about what governments are doing to try and stop people getting lung cancer in the first place. All right, so how are the government trying to prevent lung cancer? The government was slow to respond. They sometimes can be, because the evidence is sort of shaped by society and people's opinions and pressure groups and things. But once they did in the 50s and 60s, they definitely realised. So the smoking-related deaths nowadays is costing the NHS so much money. But at the same time, and if you want to be cynical about it, they were making more money from tax on the sale of cigarettes. So lots of jobs depended on the tobacco industry as well. You can understand why the governments might have been a bit slow on the uptake of that. So today, nowadays, in the 21st century, and certainly in the last 10 to 15 years, they really have sort of got over themselves in the terms of tax. And they really are trying to stop lung cancer. So cigarettes are now much more expensive. It's harder to see them in the shops, and we'll talk about those kind of things in a minute. We've already mentioned some of the campaigns that the government has set up to try and persuade people to change their attitudes into not smoking in the first place. Now, obviously, that shows the government have changed their attitudes in terms of profit over the health of the people. And that has obviously led to massive progress. Now, this first image here, we can see Humphrey Bogart. He was like a superstar, proper superstar back in the day, and he smoked in every film, everywhere, and it was people like him that glamorized smoking a little bit. And then he died very young, 57 years old, but at the time people probably weren't really connecting the two things until it was impossible not to connect the two things. When all of these people who started smoking younger in the 20s and the 30s, when they got to the 1950s and 60s, and there was this explosion of lung cancer, it was quite clear what was causing it. All right. So the questions also on whether the government should be able to take away a person's freedom. This is similar to that lesson we looked at where we've talked about the government intervening, telling us what we can eat, what we shouldn't be able to do, and all of these laws that take away our choices, seatbelts and all those kind of things. People would say, hang on a minute, that's my choice and I will take the consequences. But the government is also being pressured here in that you are telling people not to smoke and they can't smoke, but yet they want to, and it's their choice. So you've got this real debate again. But I suppose if it comes down to it, as we said in the last lesson and in this one and the great debate of this, if the government are having to pick up the pieces and fund it and treat, then they should have a say in perhaps trying to stop it happening in the first place. However, people can still buy cigarettes. It's still their right, isn't it? It just means that there may well be this consequence. So as time goes on, it's really clear. Bottom line is the death rate is too high. So that's what the government decided, or when the government decided they needed to act on this. All right, so this first thing the government did, and this is just a recap, hopefully, of what we've mentioned in the government intervention lesson at the end of the NHS lesson, so phase 3. They want to try and change behaviour. They can pass laws that force people to do things, and that's when they decide that that's important, but they also probably want to change the minds, hearts and minds, they sometimes say, and we'll have a look at that in a minute, how to persuade people to change. So these things the government did are to force people. As we know, they banned smoking in workplaces and public places as well. In 2015, that was extended to cars. You can't smoke in cars if the kid's under 18 and stuff like that. 2007, the government raised the legal age to buy tobacco from 16 to 18. All of these things, and tax has gone up as well. And you'll know that the previous government, a couple of years ago, they tried to, I don't know if they got it through, or if they had an election in between, where young people now will never ever be able to buy cigarettes ever again. So I guess, I don't know if that went through or if that's continued by the new government after the election, but that is certainly something that the Conservative government were trying to get through, that young people of a certain age would never ever be able to buy cigarettes again, and that means you now. So I think it was 15 years old about 2 or 3 years ago, and every year after that. So essentially, no child or no one can ever buy cigarettes again. In 10 to 15 to 20 years' time, there won't be cigarettes in shops because people can't legally buy them. Or it might lead to the black market, things like drugs and stuff where you can't buy drugs legally. So it encourages that black market of drugs and things like that. So who knows what the future's going to hold. But certainly the government is trying to force people to change their behavior by changing these laws. And then ways to try and influence their behavior to make them change their mind a little bit is using communication. It's really it is like a little bit, I guess, taboo to smoke now. It's not taboo, that's the wrong word, but it's not seen as a good thing. It's not cool anymore to smoke. Lots of people aren't smoking anymore. It's sort of lost its sort of charm, its appeal, because people can see the damage of it. It's horrendous when it happens, and we're seeing it more and more and more. So maybe these influential adverts, the things that we talked about in that last lesson of the NHS, where they were showing the damage that smoking does and the pictures on the cigarette boxes and all those things, maybe they're working to make people choose not to. It's one thing, isn't it, passing laws to force them, but ideally you want people to make better choices themselves. So as we know, the advertising's been limited. There was a ban on television cigarette advertising in 1965, so a long time ago. And then over time, they've now banned it in TV shows and all cigarette advertising, full stop. So you'll not see any branding of cigarettes anywhere on adverts or on television. The government has produced more campaigns to advertise the dangers of smoking. We've seen the adverts, and now all cigarette products, as we've said, they are removed from display. This is just recapping a little bit that government section. It is the case study, remember, of the Edexcel course, which essentially brings together everything we've learned in the period, and that's why this is, as much as it's a horrible topic to think about, it's a good one to show us what we've learned and how we understand those government changes, technology as well. All right. So this source is just interesting. Just to take a step back a little bit before we finish this lesson, a 2012 Department of Health consultation where people meet and discuss stuff on smoking sets out reasons why the government has taken the actions to take cigarettes out of view. This is what their evidence and what their data found. Okay, that they found that cigarette displays in shops can encourage young people to start smoking. Obviously, we know that young people sometimes do things to fit in or to be part of the crowd, or because they maybe know it's not the right thing to do, so they do it because they know it's kind of bad. Whatever that is, children have always done that, of every generation of all time. But smoking, obviously, if you get hooked on it, is very dangerous longer term. So they found, the government, that 5% of children aged 11 to 15 are regular smokers. And that's really concerning, isn't it? That means there's a really high chance, probably those children, at least, well, as we know, 85% of those children will go on, if they continue to smoke, to have lung cancer. More than 300,000 children under 16 try smoking each year, so have a pull. Maybe they're out on the field or something and there's a bit of peer pressure, so they try it. Most kids hate it, it's disgusting. As well as the fact it's really quite expensive, but that's a huge number who even try it. And those trying it, the chances are many of those are going to carry on. 39% of smokers say that they were smoking regularly before the age of 16. That's crazy. And they're asking adults, maybe these people are, the data is of adults who have now been smoking for quite a long time. Nearly 40% of smokers say they started before they left school. All right. So the government decided with all that data to cover the displays, and that will protect children from the temptation, the promotion of it in shops, so they can resist something that they can't see is the idea. If you can't see it, you don't want it. And also will help support adults who are trying to quit, because if they are on like a Stoptober program and they go to the shop and this thing was right in front of them, if they're addicted, it's like anything, alcoholics who are addicted to alcohol, if it's in their face and they just have had a bad day or something, then they're more likely going to reach for it. But if they can't see it, then they might not want it. That's the government's thinking on this, and it's probably quite a sound rationale. So with all this said, more than 8 million people in England still smoke. It's still a huge amount. It's one of the biggest preventable killers. All right. And that is the key word there, preventable killers. If nobody ever smoked ever again, after 20, 30 years, probably no one would ever get lung cancer ever again. Or certainly it would be so small that it would be negligible. So 80,000 people die every year of lung cancer. And this is not including throat cancer and all the rest of it. These are lung cancer deaths. And nearly 2/3 of those smokers, current and ex-smokers, say they started smoking before they were 18. So you can see the link. There's no doubt about it. And this is probably why I think smoking is maybe less done now. People are obviously addicted and people still smoke, clearly. But people are not stupid. They're not daft. We've got all this information the government have provided for us. It takes someone really sort of addicted or determined or whatever the personality of that person might be when you see all this stuff to do it, knowing especially when you're going to have kids. And a lot of people try to stop smoking when they do get pregnant, or grandparents, elderly people stop smoking when the babies come, because they realize that by smoking, it's going to reduce the chances of them seeing their grandchildren growing up and things like that. So there's a whole like plethora of information and data thrown at us, and all of this sort of emotional stuff connected to smoking, which is why people are smoking, or less people are smoking. But you can see there's still 8 million people smoking every year, in the UK. Therefore, you're going to have lots of lung cancer still. All right, so we've talked about these campaigns at length, and we've reminded ourselves of the previous lesson on the NHS, the Stoptober stuff, the pictures on the packets, the not being able to see it in the shops, all of those things. So let's think about some of these things and whether we think they were successful. This is one of the most common adverts. This is the one where as he takes a pull, it has this horrible sort of crackling sound and bubbling, and they say that this is what's happening inside your body. Every cigarette that you smoke, it mutates the body. This one here, the green one, healthier lungs are my big reason to quit smoking. So you'd see that. He wants healthy lungs. He wants to be able to blow up a balloon. And other ones like that, they have posters that are, I've had grandchildren or I've had children and I want to see them growing up. So they start trying to do like an emotional connection to try and persuade you to do these things. And as I was saying a little bit earlier in this lesson, it's no longer sort of socially acceptable. That's the thing. People maybe judge a little bit. People sort of snarl or look when someone lights a fag. It's just not done. It's certainly not done on buses, trains and planes. It used to be the most common thing in the world, in staff rooms, all around the place. Whereas now, if somebody lit up on a plane, you'd have everyone would be like pressing the call bell, getting the cabin crew out there. People would be tutting and hissing and huffing, because we just don't do it now. Society is generally on the way to looking at smoking as a really horrible thing, disgusting thing, really. If people started sparking up now, there'd be like all sorts of people getting involved, the Karens, if you like. But that's the point. That little bit of peer pressure has now sort of become so ingrained in all of us that we'd be shocked if we saw these things happening. And that is why lung cancer cases are going down. And that is why smoking is going down. And that is also why more people are vaping, because there's this idea that vaping is better for you than smoking. And I guess, as we keep saying, only time will tell on that one, if vaping is better for you. Now, chances are it is better for you, but that doesn't mean it's not good for you, or is good for you rather. All right, so have the government campaigns and laws been successful? Let's have a little look at this graph. The image there, you won't recognise who these people are at all. They used to be TV personalities. Roy Castle, the guy with the white t-shirt, was very famous. He never smoked in his life, and he died of passive smoking. And he was so loved and admired by everybody. It really sort of brought that to the attention of the nation and the government, that a guy like Roy Castle would die who never smoked in his life. So these campaigns were everywhere, of these celebrities of the day, famous TV personalities. And let's look at the graph, all right? You can clearly see in men and women that from 1950 to 2015, it's going down, all right? Proportion of people smoking cigarettes. Now, you might notice there in women in 2015, it's starting to go up again a little bit. That does happen. It goes up and down. If you carry this thing on now, the last 10 years since this graph was produced in 2025, I would imagine it's going down even more. So we've seen previously, haven't we, that it's about 8 million still today, from that previous graph or a bit of information. I would imagine getting closer to 2025, it's going down even more. And if it keeps going down like this, in the end, it will just completely disappear, won't it? And you'll have maybe a handful or a couple of hundred lung cancer cases every year. And then hopefully by that point, technology will be so good anyway that it won't cause deaths of our loved ones. So that is a really promising graph to be thinking about for sure. And then just again, in terms of the exam, just to step back a little bit as we finish this lesson today, let's think about a comparison of these epidemics or these problems, because this could be a question 3, the first medicine question, one way the government acted in the cholera epidemic compared to a modern one like lung cancer or COVID or something like that. So we can see in both cases, for similarities, they were quite slow in their response. We know in cholera that John Snow presented his findings, but it took them nearly 20 years to get the sewer system and nearly 20 years to get the Public Health Act. But in 1875, they did introduce the Public Health Act, cleaner water, sewage systems, toilets in the houses. All of those things came quite a while after John Snow's work, but that also came after the germ theory from Louis Pasteur and obviously Nightingale's work as well. Now, we've talked about that, but this is just to give you a little bit of a similarity. In lung cancer, the government, again, were pretty slow in the uptake. That's because of the pressure from pressure groups and the money from the taxes and things like that. So eventually, though, they did become direct in their response, and we've talked about that today in this lesson, by trying to force people to stop smoking or change their habits, and also trying to persuade people to stop it. So bans are introduced in buildings, and obviously all the advertising and things that we've talked about. So they're the similarities that you could talk about in how the government responded to these epidemics or these big diseases or illnesses. They're quite a nice way just to pause a little bit as we get onto this bit. And then to finish this topic, just make sure you fully understand it and the whole medicine course, really. It's quite a nice way to end the course. Just answer these questions in your Google Doc or wherever you're doing these notes. How is science and technology helping in the treatment of lung cancer? You should be able to answer that fairly straightforward. So we're talking about treatment in this answer here. We've done diagnostics. How have the government tried to encourage smokers to quit? How have the government tried to prevent people from becoming smokers in the first place? And how have the government tried to protect non-smokers from the dangers of secondhand smoking? So we should be able to answer all of those things by now. It takes in this lesson and also takes in the stuff that we talked about in the NHS lesson in phase 3, government campaigns. So that would be the end of the lung cancer lesson. That's the end of the medicine course fully. It's quite clear the modern period has been an absolute boom. You need to be deciding why is that. Is it individuals? Is it science and technology? Is it government? It's the same as the whole course. I do hope you've enjoyed the medicine course. I love the medicine course. Just remember, though, the whole thing is breadth, not depth. Sorry, you need to know a little bit about everything rather than needing to know lots of things in really, really severe detail. And a little summary there from our textbook that we use in class as well, just to make sure you've got your head around the main bits. Any questions, as always, please ask your teacher. And then the next video that we'll get online will be for the trenches course. But of course, every lesson is on stchistory.com. Just click on the GCSE button and pick the course that you need to be revising or learning from, or if you are watching from another school that you're picking because you want to be looking at yourself. Okay, so thank you very much as always, and we will see you on the next video. Thank you and goodbye.